Join us each week on Life Matters Today television broadcasts. We will enlighten, encourage, and inspire you to live life and to have it abundantly. We will capture the extraordinary lives of people all around the world. We will tell their story of transition from tribulation to triumph and provide resources for people that are in need. We thank you for watching Life Matters Today. My experience visiting Envita was extraordinary. I was greeted with warm and friendly smiles as I was guided through the hallways. I was impressed to find out that people traveled from across the country to receive treatment at Envita. Dr. Dino Prato is a naturopathic doctor who founded Envita. He specializes in unipathic medicine, which is a term that he coined. His modalities of treatment has given him a leading edge in fighting the war against cancer. You don't want to miss this amazing interview. I am so pleased and honored to have on with us Dr. Dino Prato. He is the founder of Envita Medical Center. We're going to talk about an alternative method of treatment, alternative modalities of treatment actually, and it's just not one, they're not two, but there are several modalities of treatment that we're going to talk about today. Dr. Dino, thank you so much for coming on Life Matters Today. It's such a privilege. Thank you very much. Absolutely. I've heard so much about you. A dear friend of mine, Lisa M. Jones, she would fly into town from Maryland and come here just to receive treatment in Arizona. And when she told me about Envita, I said, Envita? What is Envita? And so she was describing it to me, and she said, you got to come. You just got to come and sit here and see how they operate in the medical center. Everyone is like family. And then I heard more and more about you and more about your heart. I have to interview you and talk about your alternative methods of treatment. Tell us about Envita. How did it get started?
Well, Envita started over about 20 years ago, officially about 17 plus, but 20 years ago. And the idea with Envita was putting together the medical care based on the person. What we do isn't necessarily alternative, it would be integrative, because we're going to use both conventional, natural, whatever methods are going to work. But we don't build the treatment plan based on an algorithm. So in the conventional model, it's all based on clinical drug trials. So you take all these people with X cancer, colon cancer, at this stage, this type, adenocarcinoma of the colon, and they'll go through studies with specific drugs, and then you'll see the outcomes. The problem with that is cancer is a moving disease. And I use the analogy of if you're going hunting and you're trying to shoot a duck, that duck is in flight. So that mutation is changing, and the treatment is changing, and the trajectory of the care is changing. So we build the treatment based on the patient's genomics, genetics, their immune factors, causative factors of their cancer to where they're at. So essentially, the best way to explain this is we use the terminology N of 1. Every patient is their own clinical trial onto themselves based on their laboratory data findings. And this is not all just natural stuff. It's a lot of high-tech, esoteric, specialized testing in immunology, and then we build immune system treatments for the cancer. We look for what caused the cancer to treat the causes of the cancer. We look for oncogenes that are causing the cancer to speed up and how we can affect those. And then we go to the pharmacy side of things and build the medicines so that they're therapeutic, given in delivery methods where they're going to get to the blood-brain barrier for getting to the brain or into the tissue. So it goes on. So the best way to explain it is it's really personalized medicine, not just the term as a phrase, but truly personalized medicine, which I think is really what healthcare is going to be in the next 7 to 10 years.
Life Matters Today. We'll be right back. Thank you so much for joining us. Life Matters Today is back with Dr. Dino as he discusses treatments for fighting cancer.
The best way to explain it is it's really personalized medicine, not just the term as a phrase, but truly personalized medicine, which I think is really what healthcare is going to be in the next 7 to 10 years.
Amazing. And so this medical center is considered unipathic. I've never heard of that term before.
We made up the term because years back, we had to train doctors in this method we were using. And there are integrative doctors that have some good training. And there are conventional doctors that are obviously working on the clinical trial side using later technology. We wanted to unify. We didn't care if you were an MD or a DO or a naturopath, if you were licensed and practicing. We wanted to unify everybody under the practice of Unipathic Medicine, which really isn't just a practice of medicine, it's an educational association to teach doctors how to use personalized medicine for their patients, how to really spend time with the patient to find out why they're really sick, and all of these tools that they may not have for treating that patient. How do you dial that in? Well, you can't do that in a 10-minute office appointment. So the conventional model is a one-size-fits-all. On the integrative side, doctors are only using maybe 10% of their skill level. So we brought Unipathic Medicine in to train them to be able to utilize the full tools they need to help their patients.
Amazing. Okay, so today I got a chance to tour the center. Incredible. The center is just, it's a place when you walk in, it's a place of healing. I feel the healing. I feel the warmness.
That's the Lord.
Oh, it's the Lord. I feel the presence of God in your center, I'm telling you. While I was touring, your patient care coordinator.
We have a few of them, but was it Krista or
It was
Sam,
Krista.
She's amazing.
Krista is amazing. And so we took a tour around the center, and she mentioned that there are different modalities of treatment, and chemo being one.
Yes.
I was amazed to hear. So what's different between your method?
So let me explain this to you. This is simple, and you'll understand this. If I were to give you 3 or 4 chemotherapy drugs at one time, those side effects could be as high as 3,500 to 4,500 side effects at full dose. And that would be just from an algorithm book. So usually in oncology, you can't give more than a couple of different types of drugs at one time because the side effect profiles will be very high. Well, we learned early on that if we do genetic testing on your cancer cells, now, not on the tumor itself, because a tumor can be old. We're dealing with late-stage cancers. People who come to integrative care, they don't usually come early. If they did, it's easy. I don't remember a stage 1 or 2 that isn't in full remission because they're easy. I'm talking about stage 4 where they've tried everything and nothing worked. If you can get the information from that latest mutation of that cancer cell, then we can dial in all the molecular profiles or biomarkers for which drugs would work genetically on that cancer. But not just drugs, also plants, intravenous injectable treatments. So we can put those all together. And now we don't need to give you the full dose. We can give you micro doses. It's called metronomic dosing of the drug. And we can give you 10 different mechanisms of action. So every drug has a different way that it kills the cancer cell. One might kill it in this method. Another one kills it from this method. It's all different pieces of science. So we study the different mechanisms, and then we study which are the genetic targets. So we make a custom medication just for that patient and administer to them. And that's really why we outperform the conventional, because they don't take that time and attention and detail. And I know you say, well, if it worked, everybody would use it. It's not how medicine works. Medicine is very slow. The technology I'm speaking of, genomics, is, I think the past president not too long ago put commissions out to speed up that technology. We have tons of drugs, even prescribed drugs, that are no longer used today that may have been a good genetic match for you. But you would have never known that because no one's using them. So we use every tool to our ability. Now that's one part. And then the other part is building the immune system to attack the cancer. And that goes into a whole nother area. But it's all about taking the time to find out what are the best targets for that person.
For the individual. It's specialized.
No 2 patients with the same cancers have the same targets.
Amazing.
The genetics prove that. So why do we give everybody the same thing?
Amazing.
So it works if you have early stage disease, because by removing the tumor, you've done 90% of the work by the surgery. And then the chemo and the radiation are prophylactic and supportive to reduce risk of recurrence. But if you've got late stage cancers, you really need to be employing all these techniques because you want the best chance of getting that cancer before it gets way ahead of you.
Life Matters Today. We'll be right back.